Welcome to the News 13 virtual coronavirus town hall meeting. I'm Marie Johns.
And I'm George Roberts. This week, we welcome county commissioners from 4 counties in our region.
Wayne Nothstein from Carbon County, Sharon Laverdure from Monroe County.
And we have Matt Osterberg from Pike County and Jocelyn Cramer from Wayne County. Thank you, everyone.
Thank you all for being with us today. Now, people are very anxious during this time, unprecedented time. Never had to deal with anything like this, and people are looking to our leaders to see what we should be doing, what is going on in our communities. And it is a really challenging time, I know, for all of you as leaders, so thank you again for taking the time. We're going to start with Carbon County, Wayne Nothstein. Wayne, we know that Carbon was the last to actually have a coronavirus case in our area. What has been going on at the county since then, and what are you doing now? What do you want people to know?
Well, I want people to know that we've taken a real proactive stance on this. We basically have no visitors in any of our facilities. We're asking everyone to do as much as possible online. If you have to drop maps or anything off, such as for tax assessment or recorder of deeds, we have drop boxes for all the county offices. And you're to put the information into the drop boxes, and then we'll go from there. But virtually the prison and all the county facilities are not open to the public at all. And the offices are up and running, although we're at reduced manpower, 1, possibly 2 or 4 people in the offices at one time, depending on the size.
Mm-hmm. Now, you are also working on campaigns to let the public know what's going on. Can you tell us about those?
Well, yeah, we came up with a poster, Chris Lukasevich, one of our commissioners, and it's a little graphic, maybe a little harsh in that, but it certainly demonstrates the need to stay 6 feet apart or 6 feet under, and it shows a picture of a cemetery. I don't think none of us think that a lot of the public is taking this serious enough. They continue to have family gatherings, large functions, etc. And I know in our family, we're not going to have Easter dinner together, to be my wife and I. And unfortunate that we have to stay away from our families and grandchildren and great-grandchildren. That hurts at a holiday time such as this. But those are the drastic measures that everyone has to take to keep this from spreading.
Absolutely.
Yeah, I think everybody will agree that the message really here is stay at home. Sharon, let's talk to you about things that are going on in Monroe County. What do you want the public to know?
Well, we repeat many of the things that were just said. And thank you very much on behalf of Monroe County and the Monroe County Commissioners for this opportunity to participate with you. It's ultimately vitally important that everyone stays home. Avoid touching your eyes, nose, mouth. Wash your hands often and count to 20, as we've been told, 20 seconds. Practice social distancing at all times. Avoid traveling. If you're visiting from another area, we're asking you to quarantine yourself for 14 days. It's imperative that occur. We are asking you also that we do this together so we can work together to beat this together. It's very important. Our county offices are open for essential emergency reasons only. We do have drop boxes outside of all of the row offices as well for those that can drop off materials if they'd like to. You can call. We have essential employees only there to answer the phones, to answer questions, because we do believe that we really need to be here to service our individuals, our folks as well, our residents as well. That this is a tough time, and there may be things that they may need an answer to.
Yeah, absolutely. Yeah.
We're working with our vacation bureau as well as Poconos United Way. There's sites. Go to each individual site. There's all kinds of information. There's links to get further information as well.
Okay. All right, Sharon, thank you.
Let's move on to Pike County. Matt, what do you want the people to know at home?
Well, the first thing that we are really stressing is to tell all of our residents to please stay calm. We want to make sure that everybody feels safe in their homes, and that's, as you're hearing from the other commissioners, we're all giving the same message. Stay in your home. If you don't need to go out, please don't go out. As far as the county services here, we are very similar. We have very limited access to any of the buildings. We're asking people to at least call here first if they think they have essential business. Call here and ask us before you show up at the door. All the facilities are locked. They're only going to be let in by sheriff's deputies after the sheriff's deputies hear what it is that they have to do in the buildings, such as the courts or the administration building. But the major thing is if everybody stay calm, and that's the message that we continue to put out. We want to make sure that we're saying the same messages, that the messages are clear and concise. Tell people to go to the Pennsylvania Department of Health sites, go to the CDC, follow all their guidelines. We are urging, as well, we're a big summer resident area, as many of the other counties here are. We're urging people to be sure that if they're going to come to their summer homes, we're telling them, first thing, stay where you are. But if you have come here, please quarantine for 14 days. It is so important that we curtail this, that we practice the social distancing. I will say that what I see when I ride around Pike County, and I have been, that I see people are really trying their best to adhere to it. We're telling them if you have to go shopping, go once a week. Don't need to be going every day. This is for everybody, and as you've said, we're all in this together. It's just a message that we just keep on putting out every single day as best as we can. And I know all four of us, all four counties, need to continue to have that same message, and I think we are. And what I'm hearing, and I'm sure we're going to hear momentarily from Wayne County, that is important that we all work together as counties. We are the northeast corner of the state. The same visitors coming out of New York and New Jersey are coming into all of our communities and from other places. And people, in some cases, we have to understand, have to commute back to those areas. Some of them are essential workers. Some of them probably work in the medical community in New York. And we have to respect their ability to go down there and preserve and protect that community, but at the same time come up here and make sure that they're not, spreading anything more here. So we're just urging everybody to do the right thing. Let's all work together. In a short time, hopefully we'll be out of this mess.
Good points, good points. Let's go to Wayne County and Commissioner Jocelyn Cramer. Jocelyn, thanks for being with us. What's going on in Wayne County that people should know?
Thanks again for inviting us to be a part of this, and we're happy to be here. I feel like I want to reiterate a lot of what the other commissioners have said. Same thing. We want to get the very best benefit from this governor's stay-in-place order, and that means we all have to abide by these guidelines. It's changed our lifestyle dramatically over the course of this last month. It's certainly changed economic situations here. We have basically done the same thing. We consider a lot of our county services, like anywhere else, to be essential. We're here in the courthouse. There's emergency court proceedings that need to happen, but we're here. We're providing those services. We too are behind locked doors. We are protecting our employees as well as the public. Someone can make an appointment to come into the courthouse, so we're urging people to call ahead first. And again, they'll be interviewed through locked doors. We're screening people who are coming in. We're making sure that, again, that we're protecting the employees and the public. We're on a limited staff here as well. We have as many people working from home as possible. We do have some internet issues here with our broadband capabilities up here in Wayne County, but we're making do. And we can't wait to turn around and focus on the recovery of this, but urging the same thing. I'd like to also add, one of the things we're reminding everybody to think about is please don't take any unnecessary risks. I have elderly parents. I don't want my mother cleaning on a stepladder. The hospitals and our emergency responders are really taxed right now. So be very careful in your everyday life so that we don't have any unnecessary drain on those resources.
All right, thank you very much. Now, we did mention a little bit, thank you all for that initial overview of what's going on. Commissioner Osterberg, I know you had mentioned about the people from New York and New Jersey, and that really affects all of our counties. We know that we are a bedroom community for New York City, for people commuting back and forth. And I know that this is a huge thing that we've been dealing with, trying to stop those Airbnbs, trying to stop people coming here unnecessarily. But those necessary and essential workers that are going back and forth doing an important job, it's affecting all of our counties. Matt, tell me a little bit more about that, and we're going to get some of the other counties too, because I know it's kind of affecting you all a little differently. Matt, what do you have?
Well, I know that there's some cases where some of the bus services have ceased, and I'm not sure all of them have yet. We just have to realize that there are going to be some people that are going to have to make that trip back and forth. If they're able to stay down there, that would be the best thing. But I guess at the same time, they have family members here that they come back to. But I would hope that most of them and I'm talking about the medical professionals that happen to live in our area that have to go down there to their jobs and perform their services, that maybe they are staying down there. But I'm sure that there are some that have essential jobs that have to come back and forth. So again, we're just putting that message out there for them. If they need to do that, obviously they may not be able to quarantine for 14 days, but that they're extra specially careful when they come back here about who they're going back around. If they're just coming from here and going right to their home, that would be the best thing. We offer services in the county. There's a lot of supermarkets that are delivering. So we are out there pushing all that information so that they can keep themselves safe and keep us safe at the same time. So I think that's the issues that we're up against when we live in a bedroom community for the metropolitan New York area. We want to curtail as much as we can with the bed and breakfast and that. And I know the governor has just put out an order to that, particularly about the advertising part of it, which maybe we can get VRBO and Airbnb to stop their advertising so that can slow down. But the other part of this, I think we're just going to have to keep on putting the message out there, because there's going to be some that have no choice but to commute back and forth during this crisis.
Yeah. Jocelyn, as far as Lake Wallenpaupack isn't part of your county. There are a lot of second homes there, and you have other communities where people have vacation in second homes also. Do you have any numbers? Have you heard about how many people have actually come up here to kind of, escape the city, escape from New York, New Jersey, Philadelphia?
We don't have any numbers on it right now, but we are definitely an area with an awful lot of second homes and camps. So just like what Commissioner Osterberg has mentioned, we really want to urge people that are in the area to quarantine. And for everybody else, in the good times, this is a very vibrant community with a lot of visitors, and they're vital to our economy here. But right now, we want to make sure all of us take those extra measures too, because our counties do have people coming from other areas right now. Hopefully they're quarantining. But we're talking about if the markets that are delivering, as Commissioner Osterberg mentioned, this is great. When they deliver, we're having people leave bags outside on the porch for a few hours, use gloves when you're handling your goods. Take all of those extra measures. If we all flip that switch in our minds from, how do I not get infected, to what can I do to protect someone else if I am infected? Think of it that way, and our measures will be more effective and as intense as they need to be.
Now, we know, being here at the TV station, we get a lot of emails, a lot of calls, a lot of complaints about what should be being done. And I know you guys in your offices are receiving a lot the same kind of thing, especially on this topic of people coming here or going back and forth from New York or New Jersey. Wayne, for Carbon County, that's Kidder Township, Penn Forest Township, the northern tier where the people are coming in, and we have that whole issue. Are people calling your office, and are you hearing things? What do you want people to know about that, and what you can actually do about that, and what we are doing about that?
Yeah, we've been trying to track the hotspots, as we call them, with GIS. We've gone to our mapping department and took all the addresses of the second homes and B&Bs and all those different facilities, and we came up with a map and showing the hot zones where those high concentrations are. We get a lot of complaints from the residents in those particular areas, asking us to stop the buses and the traffic between out of state and Carbon County, as well as the other counties, I'm sure. And the local municipalities are also getting the same calls, and we have absolutely no authority to do that. As Mr. Osterberg pointed out, a lot of those people work in the city every day. They have their families here. They're traveling back and forth. It's extremely difficult for them right now, especially with the schools being closed. They might have young children at home. People with rental cars, you can't always assume that the people from out of state are in county residents. They might have a rental car New York, New Jersey plates on, et cetera. So I think people have to realize that too. It's just not that easy to just close off the borders. It isn't. And a lot of our municipalities and dispatchers and et cetera are getting those calls.
Yeah. And Sharon, we don't have, or you don't have the authority really to set up or like roadblocks on Interstate 80 to stop people from coming across or doing some sort of a checkpoint, you know, that some people have suggested.
No, we don't, nor do I think we want to at this point. I think we need to really speak candidly like we are. I do believe there was authorization today as of April 1st to halt any short-term rentals in the area in conjunction with Pocono Vacation Bureau's suggestion, plea, whatever you want to the governor, however we say that, to stop those rentals moving forward until further notice. We are in support of that as commissioners, but that's about what we can do at this point. Townships are, as other commissioners have said, townships are part of that discussion as well. Homeowners associations also can take a lead in that as well within their own establishment areas. So asking for those folks to participate with that and support what we're doing is important as well. Any persons coming in here must quarantine for 14 days. That's imperative.
Well, Sharon, you mentioned the municipalities, and I know some of them have tried to stop people from using the playgrounds, and you know, we have county parks, we have state parks. We don't want people congregating there, but I guess if you use safe distancing, right, you can still walk the walk.
Correct. Yes, our county, Monroe County, owns the one out by the correctional facility. We have signs up, no gathering. However, you may walk within safe distance, walk by yourself. That's important too, to be able to have that outlet for certain people that absolutely it's necessary.
All right. In Pike County, Matt, I know that EMA in your county has been particularly really active about getting information out. Tell us what they've been doing.
Well, what they've been really doing is, again, getting essential equipment to all of our emergency services, helping Dingman Medical Center, which is a testing facility here in Pike County, get out the word that people can call there, don't just show up again. This is all the same protocol. And go to get Dingman's Medical on everybody's radar that if they feel they need to be tested or they're having symptoms to call there. While we're in rural counties, and in particular in Pike County, we don't have a hospital. So that part of the thing becomes a little bit of a struggle, or an urgent care that we're dependent on all our neighbors, whether they're in Pennsylvania or in this case also New York and New Jersey for hospital care. We are getting the word out that there is a testing facility in Pike County. I know the EMA is pushing that pretty hard because people are calling here and saying, where can I be tested? So we just need to do a better job, and I know we are, to send people to that facility. And he's also working with all of the emergency services. Again, we're back to, before this all started, we all had a crisis looming with ambulance services in our community. This just heightens it further. And we're dealing with this yesterday with, we have to ask some personnel that are very important to the 911 center, particularly, that we can't have them running on ambulances also, because we can't afford that the 911 center become infected with this virus. So, because that's really essential personnel. So, these are decisions he has to make, and then working with the townships to figure out how they can bolster at this moment their ambulance services. I just know, on a side note, last night, Milford Borough allocated money, which they really don't have a lot of, they're a small community, towards paying some staff to be on their ambulance services during this crisis. So that's what we're doing here with EMA. He is active throughout the county trying to, and again, it's back to the same thing, calming people's nerves. If I could just say one thing about the vacation rental, the one thing we need to do is realize that we have to respect the people that have decided to make that decision to either to come to their rental home and use it, because they're under the same stresses with their family. They feel safer here than they do maybe in Manhattan or whatever. It's not an easy decision for them either to want to leave their homes, but we need to respect their decision at the same time, urging them to quarantine. So I just tell the residents, respect what your neighbors had to do. This is not easy stuff, but they also have an ability and a right to come here and use their homes. Just, again, tell them to quarantine for 14 days.
You brought up something interesting about, the people that have come here to kind of escape the city and everything, but their place of residence is back in the city. And this brings up an issue that officials haven't really addressed all that well. And that is when we do have somebody who has a case, in your county, because they don't live in that county, are you not seeing the real numbers of cases in your county? Are they attributing it to their place of residence? Do you think the numbers that you're getting from Pike County are accurate as far as coronavirus cases?
I've heard that very issue, George, and I don't know the answer to it. But I do know that in the case of Pike County, where this is what I've been told again, that the one death that's attributed here to Pike County to this is a person whose actual legal residence is New Jersey, but they're listed as Pike County. So I'm getting mixed messages about that, about when they go and are tested here at a local facility. We'll take the Dingman Medical Center. Are they listing them as somebody who's infected by the virus? Are they connecting them with their home, or are they connecting them here? I don't know that answer. I guess I could find out by calling down there and talk to the doctor. Yeah. But like I say, the one death is from somebody who came here from out of state, which I know has been reported.
Right. Jocelyn, how's Wayne Memorial Hospital handling it? How are the health facilities handling things in your county?
Well, we do have a hospital here, and I want to give people a better picture of Wayne County. Our population is about 51,000 people. We have about 450 to 500 employees for the county, and Wayne Memorial Hospital has 114 beds. It's a small rural hospital, and they have been preoccupied with this for over a month and managing. But like all of us, we don't know where we are right now. Are we still at the beginning of this thing? Are we midway through it? We all anticipate that spike that you're talking about, and the next few weeks will be critical to determine that. So whether, hopefully that hospital, which does an incredible job in our community, and apparently they have enough PPE, the personal protective equipment, for now, but it's not an immense hospital. And when the stay-at-home order was issued here, we were happy about that because we now had the same regulation as the other neighboring counties in New York had. So we cut down on the influx from that area to this area because we were less regulated, including hospital policies. So for us, that was good news. And again, up here, we've got a lot of people familiar with the area. They have come up here and enjoyed it and enjoyed some of the Airbnb properties that we have, but we don't know what's next. And we have to make the best decisions for our community here. Do we need those Airbnb facilities so that hospital workers can quarantine themselves from their families if need be? People that are thinking about coming here, I urge them to consider that. It's not the same situation anymore. We've got to protect our healthcare workers and our EMS responders first and foremost.
Yeah, absolutely. Well, and the hospitals in Carbon County, Wayne, we have two hospital systems, Lehigh Valley and St. Luke's, working together. What is your understanding as far as the hospitals in Carbon County and how they're doing?
Well, this morning, talking to the St. Luke's Health Network director, he had called me, and we seem to be holding our own, but then again, our case number is really low. We've only had one death, and it goes back to, we're all sure that the numbers are a lot higher, but we don't have the testing. The hospital in Lehigh and St. Luke's, they are putting up a tent today to help service the clients or patients that might come in with the COVID-19 symptoms. And they'll be triaged at that particular place. Emergencies still would go to the emergency department. They're just trying to separate and keep our ERs septic and clean and for emergency patients. So they're taking a proactive stance right now, putting up the tent with the proper medical supplies and precautions to help screen those coming in with what they think might be the COVID virus.
And Sharon, I understand that the Army Corps of Engineers was up in the county, was it last week, taking a look at potential places to put more hospital beds. Can you elaborate on that?
I can tell you what I know, that I'm under this understanding that the Army Corps of Engineers did come in. They have visited several locations, but I have not been given any formal information as to exactly where they were and what the outcome of that visit was. We have forwarded through our emergency control some locations that folks have called and said, you can consider us, you can consider another location. So we forward those through our Monroe County Control Center to PEMA, so the Army Corps of Engineers might visit those locations as well. But I have not been given any definitive information or outcomes from that visit. Okay, yeah. I would like to also. Go ahead. I'd like to also say that both St. Luke's and Pocono, our Pocono Hospital, Lehigh Valley Pocono, have tents are being erected as well, and they're ready for any overflow that may occur to help in the future. They're being very proactive, which we appreciate.
Right. We had heard that East Stroudsburg University was a possible place, maybe some of the resorts. Did you hear anything like that?
I have not been. I did hear that they were looking at East Stroudsburg University, but because it is a state school, and I also heard that they were looking at the other state school affiliates across the state as well. But East Stroudsburg was one of those, but nothing else definitive from that. What they found out, what they liked, what they didn't like, will it work, won't it work? Not sure. Have they contacted the hospitals to see if that works for them as well? Not sure.
Okay, so the other counties, the other commissioners that
direct, that's a concern. I have to tell you, that's a concern. I have not had direct communication with PEMA, Army Corps Engineer, whoever is organizing this, and that's we're reaching out and we're following the channels and we're waiting for responses.
But you're concerned that they're not contacting you, the head of the county commissioners. You're the head of the county and you're not being told anything.
No, and I see that just shows you that there is a different chain. There is a different avenue for these things. And I don't want to slow anybody down, but I also want to know what's going on so we maybe can help facilitate this for them.
Sure.
Mm-hmm. How about the other commissioners that we have on the line? Do any of you have any insight? Has the Army Corps of Engineers come through your offices, or are they going individually to places? Any of you?
We have not heard, and I guess I need to talk to my EMA. It's a little bit different here, and I'll go back to the fact that we don't have any hospitals here. And I don't know how that plays into all of this when there's no medical services here, like I said earlier. And I just want to say, between Bon Secours and Port Jervis, Newton Hospital in Newton, New Jersey, Wayne Hospital, and also the two facilities in Stroudsburg, they are really what service Pike County when it comes to the medical needs. And I just want to add to that, they are down in Lehigh Valley. They are performing tests. We are sending residents to that area. Most likely that's going to be the people from Lehman and Porter Township heading that direction. And the people where we are right now in Milford, I would think are either going to go to the Dingman Medical Center or to Bon Secours. So I haven't heard where they're thinking about locations for hospital units such as you're speaking of. Our EMA, I know just in our plan that we have all the time, has identified places where there would be places for this to be located, but I haven't heard that the Army Corps of Engineers has contacted us, because I think they're focusing most likely on places like Monroe, where I know they have more cases, and being as close as we are, that if there's cases here, they're probably in the hospital in Monroe, or they're in the hospital in Wayne, or in these other two locations I say. That's just what I know at this point, or what I'm thinking that they're doing, but we will find out from our EMA when we're done here.
Okay, Wayne or Jocelyn, anything to add to that before we move on?
Yeah, what we're seeing here is the slowdown in people visiting. The Corps of Engineers has not been in, but both hospitals, St. Luke's University Network and Lehigh Valley, have both been very active in doing the testing they can. But in speaking to St. Luke's this morning, Mr. Ms. Foley has been telling me that people are not responding or going to the healthcare facilities like they should be when they have symptoms. And I think that a lot of that is they're fearful of contacting the virus when they go to the hospitals and that. And if they are positive for coronavirus, it's going to affect their health long term. So the word from the hospitals or encouragement to go out there, the facilities, the urgent cares, the different facilities, the different names you have for them, strongly encouraged to go to these facilities and get checked. Because if we don't, you're going to remain in contact with your family, not take precautions, etc. And again, we don't know what the numbers are. And we wish we had more cooperation from the Department of Health in that respect, and at least give us the area where they're at so we know where to concentrate. But the word from the hospital is don't be afraid to go to those facilities. They are taking the proper medical precautions that they have to protect ourselves and our other emergency responders.
Mm-hmm. Now, I don't know if I know in Carbon we've talked about this. We talked about yesterday on the news that report card that's out on Unicast. Have you all seen it, where the counties are given a grade as to how we're doing with all of the physical distancing? So I don't know, Jocelyn, have you seen that? Do you have any, I'm not sure what the grade is today. I haven't looked.
I don't know what the grade is today. But like Commissioner Osterberg mentioned, when I'm out and about and I'm driving around, I see most of Wayne County responding very well. We've been taking this very seriously from the day that non-essential businesses were asked to close. It's so important that people do that, because again, all of these efforts are threatened if anybody violates any of these mandates. So we are encouraging people to do that. I think the social distancing here has been very good, and we have been accommodating everything. And our employees, we're doing conferences over the phone whenever possible. We are gatherings, we're just not having them. Not the commissioners, not county employees. We're doing everything we can with as few people as possible. So I think that our response has been very good. We have a D-.
You have a D-, yeah.
Wow.
They're looking it up in the control room as we go. So.
All right.
Oh,
well, we'll be doing this tomorrow and how we can improve that.
Right,
Yeah.
We got to watch the grades go up, right?
Yeah, for
Grades.
sure.
We're going to take a little bit of a break here, and we'll be right back in just a moment. We'll have more commissioners from our area on our special broadcast. Stay with us. Welcome back to the News 13 Coronavirus Town Hall meeting. Our guests are the county commissioners in our Pocono region from the 4 counties, Pike, Monroe, Wayne, and Carbon. And Marie?
Well, we looked up while we were in the break, since we were just talking about that grading system that Unicast came up with, and Jocelyn, we had said Wayne had a D-. Carbon and Pike, we just looked up, they both have Ds, and Monroe has a B-, I believe. Maybe because Monroe got into all of this first. I don't know what the reason would be.
I don't know either, but Sharon, maybe you can tell us. Why do you think you're doing so well with social distancing?
Monroe, you mean?
Yeah, Monroe County is doing well. I mean, a B- is not bad as far as social distancing goes.
Well, I didn't know that, and being a forever educator, I'm very proud of that, to be honest with you. I think that we're all supporting each other. I think that, and hearing what the other counties are doing, I think that maybe people need to look at those D-, because we are supporting each other. We are recommending social distancing. We are out there in the public. We have, I think one of the major components is early on, the Pocono Mountain Vacations Bureau and the Pocono Mountains United Way have connected together with all the different agencies to try to bring this together for the social services perspective and the work that we're doing in those areas. That's been ongoing for a month. So I think that may be help with that. We have a lot more we can do, and I appreciate all the work that everyone is doing. But I think that those two areas are huge in trying to help us move forward in supporting our residents of Monroe County.
Sure. Sure.
Well, I'm going to go with that. You had a few more days. That Monroe had a few more days. The rest of us are going to catch up. What do you think, Wayne?
I certainly hope so, and we'll have to look at how they really came up with that and what are we doing wrong or not doing at all. And I thought we're picking up, I think, on the distancing end. I think we need to get out there more. At tomorrow's meeting, we're going to have someone on the line from the St. Luke's Health Network and explain some of the things and help get the word out there why it's so important to distance, and even as far as those that had been had the virus, how long is it in their bodies? When are they safe to be around, etc.? We're hearing conflicting stories now. They're told one thing that they were supposed to after they were diagnosed, 7 days quarantine, 3 days after their fever. It means if on the 6th day your fever finally breaks, it's still 72 hours. Now, I guess there's questions on that. So being more proactive, we're going to have a doctor on the line from St. Luke's to help explain some of that and get more publicity out there and why we should quarantine.
Mm-hmm. It's an awful lot of information for us all to absorb so quickly, and such big changes in life. It's completely understandable why this takes time and why people need help understanding it.
Right. We've been in this now for a few weeks. Now that we've had, the non-essential businesses closed down, we've had the schools closed down, county offices, things have changed there. And as you look back over the past couple weeks, do you feel that you've had a proper amount of contact with agencies, state agencies, federal agencies? Have they been contacting you at the county level enough? Matt, let's start with you.
Well, the sense of the amount of emails I get a day, I think that they have been contacting us quite a bit. Okay. I know that every one of our state and federal reps has been emailing us with updates on all the things going on in Washington when it comes to this bill that they passed to give businesses some relief, also with the counties, and also our local reps, Lisa Baker and Mike Pfeiffer and Rosemary Brown, also for part of our county, have been very actively sharing with us everything that's coming out of Harrisburg. And we've had an open communication with them. So I think we're getting enough information from them about what we're doing. And then our suggestions of we'll just talk about the changing of election day, which I think was really important that they moved on that. I know all of us were telling them that they needed to do that, and they did. So I feel that they're giving us a lot of information. If I could just go back to the ratings for 1 minute. So if you could send us, I don't even know what website or email that's on, because, while, what we see and what do I know about social distancing, never even knew the term existed until a month ago. But what is it that maybe we can do better from them? How are they measuring this?
Right.
And then we can have an idea of what we need to do in our counties to make it better, Mm-hmm. So if you could share that email with us, again, we need another email, but that's an important piece of information that we could use so that we can then go out to our community and say, this is where we're, failing or we're not doing as good. So if you could do that, I would really, truly appreciate you give that to us so
Sure.
that we can do a better job, because that's what we're all here to do, is to do a better job and get this social distancing.
Right. The website that is on is unacast.com, UNACAST.com. We can try to get that on the screen. and you can copy it down, and there's actually, you can get into you can see the whole nation. It breaks down by state, it breaks down by county, and they're saying that they're using things like travel records and all kinds of, any kind of information through apps that they can gather on our movement in our communities, and that's where they're coming up with the number, as far as my understanding at this point.
Yeah, a
so-
lot of data.
A lot of data streaming into that.
I think it's important for us to see that because, again, where we're located in the tri-state area, if they're measuring things like, we have a lot of shopping here. That shopping is also a very active shopping location for people in New York and New Jersey. Because there's, when you go across the river into Port Jervis or into Montague, there's nothing really there. So they're coming over. So, and I'm not saying they shouldn't, but I would really like to know how they're monitoring that and what we can do
to make it better.
stronger.
Yeah.
Right. Jocelyn, let's go to you in Wayne County. You mentioned something about broadband service not being too good. You have a big county and you have a lot of rural area there. I'm sure cell service also is not good in many areas. Has this created any challenges during this outbreak?
In a word, yes. Our broadband is really limited here, and we're all used to that on some level, especially in northern Wayne County. But in times like these, it has limited our ability to respond to this public health crisis. So your previous question about, are we getting enough information in? I want to agree with the other commissioners. We are getting good information, but the opposite is true. I also feel like we're getting our concerns out, especially to the legislators, and Matt mentioned a bunch of them, but we're being heard. We have our needs, we have our concerns. We've been talking about our broadband needs for years now here in Wayne County, but this public health crisis has really put it on the forefront. And we've been talking about it all day and all through this crisis, including conversations even today. We've had regular conversations throughout this crisis with some of our other county commissioners on what they're doing, what can we do. We are all in this together, and if there's something that we can do that we'll do better, we'll do it. So we started really making the phone calls about people coming to the area. I'm going to say 10 days ago, and all of our legislators were very attentive, gave us time, and it wasn't long after that before the governor asked those travelers to quarantine, and then so did the White House. We're really grateful for that. I'm really impressed with some of the communication during this crisis, to be honest with you. But I'd love a better broadband capability to respond to it, because I don't think any of us think this is the last thing we're going to have to deal with.
Right.
Absolutely.
Sure. Sharon, communications in Monroe County, how have communications been for your county, with the state, with federal authorities? How are things going there?
We have direct communication with our elected officials as well. They've been very supportive with some of the initiatives. And they've also given direction as to try this, or maybe write a letter to this person. That's been very helpful. As far as Monroe County having communication abilities, we have some dead areas. We've been working on. It's just kind of amazing. Right after I took office, broadband was one of my major initiative. We started right off the get-go in January, and then before we knew it, we had this situation upon us. And we have many dead areas. We have much work to do in that area as well. I'm very concerned about our young people that are trying to do school remotely at home, and with the way the system is working and the broadband and the different companies that are servicing in the dead areas that we have, because we have peaks and we have valleys. And that really does cause some issues with that. Yes, to answer your question, initially, we have direct communication with our elected officials.
Sharon, we haven't even had a chance to really talk to the educators yet about how they are dealing with this at the different school districts, because I know that, they're all trying some different things to try to educate the kids.
They are, and I think what we're all dealing with right now is just a complete overload of information. You talked about the volume of emails and the volume of stuff that we have to look at on a daily basis to think about all these issues that you have to be addressing. Wayne, what are you thinking about the communication that's been going back and forth?
I think it's been very good. We're getting a lot of emails. text messages, conference calls with our local elected officials and U.S. senators. So it's been really good, I think, from that level. I think possibly the federal government could be a little bit better on some of the information we're getting from them. But overall, it's really been pretty good. And even as far as our Commissioners Association, we're getting emails every day, several a day. It's hard to keep up with all the emails that we have now.
Mm-hmm. Now, moving forward, I mean, we're gonna start to wrap everything up in our show today, but we're looking ahead. None of us have any idea how long this is going to go on and how long we're going to have to live like this, and we're hoping it's sooner rather than later. But one at a time, we're going to go through you and think about the coming weeks and what you see happening, what you see coming up, if you have any clue, and what you want people to know. Jocelyn, why don't we start with you?
Great question. I think that when they talk about schools being enclosed indefinitely at this point, we're talking about to the end of the school year. I think what's good about that is it's all given us a psychological timeline, and we've got to keep doing this for as long as it takes, to be honest with you. But one of the things I want to leave you with is let's talk about elections for a second, because our primary that was scheduled for April 28th has been moved to June 2nd. And here in Wayne County, and I assume the other counties as well, and maybe you guys can speak to that too, because I'm learning from some of the things you're sharing as well today. We're prepared to do that election on June 2. We can do it as we've always done elections. We could do 100% mail-in ballot if we had to. But please know that we're functioning and here to serve the community, both for our essential services, for our very vulnerable population, but also for our elections on primary day. We will work through this. We will get through this together. Each of our county commissioners oversees a county staff that needs us right now, and they need paychecks. They need those benefits. We, as soon as we do get through this, can't wait to work on the recovery. So we're here in Wayne County for anybody who needs something, and I'm wishing all of you and all of your listeners and viewers today to stay home, to be safe, to be smart, and we'll get through this.
Matt, let's go to you in Pike County, and what do you see in your crystal ball? How are we going to, how are things going to evolve here in the next few weeks?
Well, I'll just have to say, I am the eternal optimist. I honestly believe that within a month or a month and a half, we will be not completely out of this, but we will be moving towards recovery. And I just want everybody to, again, the words are, and we hear them all day long, is everybody needs to remain calm and follow all the rules that we've put in place. This is very disruptive to everybody's lives. So I see this as, a month and a half, what do I know? I just know what you guys hear on the news and whatever. But again, being the optimist and hoping for the best here, that if we all just follow these rules, we would get out of this faster, And when it comes to the whole thing, when we think about things, we're all in this together, that's really, we're all in this together. And whether it's during this crisis or any other crisis, we're all in everything together. I see also coming out of this, though, there's a lot of lessons that we're going to learn here. I think we're going to learn how to run things a lot more efficiently. I mean, just what we're doing today by this Zoom. I never knew Zoom from whatever, a month ago. But here we are having a very efficient meeting with with 6 of us in the same room. And I think moving forward, we're going to learn a lot of things that'll teach us how to be more efficient and how to be safer. We will have more partnerships, I think, between counties. Whether it's between Pike and Monroe or Pike and Wayne, and probably with one Monroe and Carbon, again, because of our neighbors. So I see that after this, there's a lot of after action discussion of what we can do better. But I really do just wish everybody the best. I wish all of our medical staff and everybody that's on the front lines of here and our EMS services to be safe. And I also urge the residents to be patient with everybody going through this. I know we're all running on the edges of emotions. And I know here we have a lot of seniors, as in all of your counties, that are calling transportation. They're alone in their homes in many cases. And I know the aging officers are doing their best to keep in contact and bringing meals to them. And we're just urging them to, if there's questions that they have, here in Pike County, to call the commissioner's offices. We're here to help you. We're here to calm your nerves. The number here, and I'm sure you can post this, is 296-3569. We want our residents to know that the elected officials are here to listen to what they have to say, so we can share that with our state and federal authorities if there's concerns that they have that we can't meet. So I wish everybody well. Hopefully the next time we have one of these, we're talking about the recovery plans with our economic development agencies and help all of our businesses get over this when it is over.
Absolutely. Thank you. Thank you, Matt. And yes, I'm with you. I'm an eternal optimist as well. I think what we have to realize is that we're not going to snap our fingers and it's going to be over. It's going to be probably a step down from what we're doing now to our normal. Wayne, looking ahead, what do you see in the next few weeks?
I'm hoping we peak out in about 2 weeks. I think our low grade listing, maybe in Pike as well, or in Wayne, our numbers were so low and people were not taking it seriously. And now that we're have more tests available and faster response time on the test, I think we're going to see a peak within the next 2 weeks. And I think it's going to slowly drop off from there. I know on the county level, we've been trying to distance ourselves. Even if you watch our commissioners meeting tomorrow, I might be at the front table or my fellow commissioners are at the side. Everybody else is in the back. The news media no longer comes. Well, maybe 13 was here last week, but the newspapers, they did it from home because they can watch it live now, and they call in at the end of the meeting to get the questions answered. So we're trying to distance ourselves here in the office. We have 2 commissioners on one day, and the following day it's commissioner and county administrator. Our staff is split in half. We're looking at reducing the numbers even further, probably Monday, to bare minimums and still be able to provide those services. We are open, call some offices by appointment. You can drop off your documents, et cetera. So we are open. We're getting there. And I, again, feel that about 2 weeks will peak out, hopefully less, but not quite as optimistic as Matt maybe, but we're going to get through this, and working together, we can make this happen. But big thing is people, like everyone else is saying, they have to follow the guidelines and recommendations of CDC, Department of Health, and our elected officials, and we can make it go away sooner.
Sure, sure. Thank you. And Sharon, we're going to go to you last here in Monroe County. Of course, Monroe County has been dubbed the hot zone for the coronavirus in our area,
Yes.
and with good reason. I mean, we're most populated, very close to a metropolitan area. Interstate 80 runs right through the county. You can go on and on, but moving ahead, what's the new normal? What do you think you're looking at, Sharon, for the next few weeks?
I think looking, I don't even want to. I don't even want to take a chance of projecting anything. I think we're day to day, moment to moment, and I think that continuing to do and moving forward what we're doing, getting the word out that it's imperative that we distance ourselves. It's imperative that we only leave our homes when necessary for essential business only, moving forward. Staying calm as much as possible. And I know that folks listening are going, yeah, right, lady, it's easier for you to say. I know it's not easy for anybody to say, but we appreciate the work that you're all doing to stay calm, to support each other, to work together, moving forward. And thanking our healthcare folks that are working on a day-to-day basis, our first responders on a day-to-day basis, our essential employees on a day-to-day basis. And I would like to also reiterate what has been said before. We are here as county commissioners to serve the community. Please feel free to call us. Please feel free to email us to get any answers that may be necessary. And I think stay home, stay calm. We can beat this together. And we're here for our community as county commissioners.
Wow.
Thank you very much. Well, I think we can all agree, stay calm, stay home, stay home, stay home. We'll say it 3 times so
Yeah.
people get it. Stay home, 4th time. And thank all of you for continuing to have our counties running. We really, really appreciate your hard work, especially very unprecedented times. So thank you all for being here today and for keeping our counties running.
Yeah, especially for being on this broadcast with us so that we can get the word out to the viewers and people here in Northeast Pennsylvania.
All right, so stay at home, and
Yeah.
thanks for being here.
That's right. Don't forget to keep watching News 13, Pocono Valley and Night Reports for more updates on the coronavirus pandemic. Thanks for watching.